Hello friends, I am here to talk about the most trending topic, coronavirus disease, which has been the talk of the town and now it's a crazy topic these days. And also being a community health physician, it's my responsibilities to make you people aware about the emerging public health problems due to coronavirus disease. So let's get started with the topic coronavirus. On 11th February 2020, the new coronavirus was called as COVID-19 by World Health Organizations, and also the World Health Organizations declared coronavirus disease as a pandemic on recently 11th March 2020. So coming back to the coronavirus COVID-19, coronavirus are the last family of viruses, and coronavirus causes illness in animals or humans. In humans, the infections ranges from mild common cold to severe outbreaks like SARS and MERS. And SARS stands for Severe Acute Respiratory Syndromes, and in SARS outbreak was also happened to occur in China itself in the year 2003, and during that outbreak there was around 8,000 cases reported from around 29 countries, and there was around 700 deaths due to this SARS outbreak. And subsequently second coronavirus outbreak in terms of MERS was occurred in the year 2012, and the cases was mostly reported from Saudi Arabia. And from the year 2012 to 2018, around 2,000 cases of MERS were reported and 750 deaths were reported from this MERS outbreak. And now we have a coronavirus infection causing an outbreak called as COVID-19. This coronavirus is an enveloped single-stranded RNA having helical symmetry like springs. This coronavirus is divided into four genera called alpha, beta, gamma and delta. But only alpha and beta genera are known to cause coronavirus infection in humans. Okay, this is the novel coronaviruses, and if you see the structures, there are the spikes like molecules, and this is going to cause inflammations of airways epithelial cells, and the cells in the lungs is also having receptors for this spikes like structure of coronavirus, and therefore it is going to cause inflammations of epithelial cells in the airways. So the individuals infected with coronavirus will have the manifestations like the sore throat, shortness of breath, cough, and pneumonia-like features. Also, this novel coronavirus is a category B infectious agent or bioterrorism, meaning that it has a very high infective potential but a low mortality potentials, meaning that it infects more but kills less. Whereas in category E infectious agent, it has a high infectivity and high mortality potentials like we have in anthrax and in plague. But the problem with corona is not the death but the number of cases. Now the question is, from where did this virus origin from or come from? So it's known that coronavirus circulates in the humans. It's known that the coronavirus is circulating among the humans, like the camels, cavity cats, or the bats. So this is called spillover. Sometimes the viruses can jump from animals to the humans. So this condition is called as spillovers, and this is due to various factors like whenever there is a mutation in the viruses or whenever there is increased contact between the humans and the animals. Now let's say, for example, MERS. MERS has been transmitted from the camel. Similarly, in the SARS outbreak, it is said that this outbreak was transmitted from cavid cats to the humans. And now the animal reservoir for this coronavirus 19 is exactly not known, but it is believed that it is from bats or snake. And this second figure shows that the cross-species transmission of bat-origin coronaviruses, and the dashed line indicates the potential or unknown transmission from pigs to the human coronavirus infections. Now, looking at the spread of COVID-19 globally, the disease started from Wuhan province in China in December 2019. Slowly and slowly, it spread across the world. And now, if you look the current status of COVID-19 as of 23 March 2020, around 185 countries has been infected with this coronavirus infections. And among all the countries beside China, Iran has been affected the most. And among the European countries, the Spain and Italy has been affected largely. And slowly it is spreading across the world. World Health Organization's risk assessment, when it was done, it was found that for China it was very high, and similarly for regional country it was also very high, and similarly at the global level also the risk for COVID-19 was also evaluated to be very high. Now, the World Health Organization's status of coronavirus disease outbreak up to now, 22nd March, there is around 2,67,013 confirmed cases due to coronavirus disease, and among them, there is around 11,201 confirmed death due to this infections or disease. And this disease has been reported from around 185 countries. And the good thing is that around 70,000 cases has been recovered from these infections till now. Now, looking at the precise epidemiology of this COVID-19, the causative agent of this COVID-19 is novel coronavirus, earlier known as SARS coronavirus 2 or part 2 SARS coronavirus, and the sources of infections is the cases from whom we can get the infections. The incubation period for this disease is around 2 to 14 days, and this is the reason we said to isolate or to keep the quarantine for the person infected with coronavirus disease for 14 days, that is for the maximum incubation period. Now, the mode of transmission is predominantly droplet, but it can also be transmitted from the contacts and the fomites. For all age group are affected with this disease, but these are more commonly seen among those who are greater than 30 years. The case fatality rate of COVID-19 is around 2 to 3%. The case fatality rate is less than 1% in age 50 years and above, but the case fatality rate increases suddenly to 10% if the individual's age is 80 years and above. And the more important thing is the case fatality rise if there is a comorbid conditions like diabetes mellitus and hypertension. Now let's have a look at the timeline for COVID-19 globally from starting of the infections in early December 2019 to March 2020. On 1st of the December 2019, the first case was identified in Wuhan, China, and by 31st December 2019, the country office for WHO region, China, was reported with several cases of pneumonia of unknown etiology. And on 1st January, on New Year Day on 2020, what happened? The country of China called as Wuhan seafood market was closed, and subsequently on 7 January 2020, Chinese health authorities identified the organisms as a novel coronavirus, and on 11 January, the China recorded its first death linked to novel coronaviruses. And on 13 January, the Thailand becomes the first country which reported the cases of coronavirus outside the boundary of China. Similarly, on 20th January, the US reported the first cases due to COVID virus 19. And on 13th January, WHO declared a public health emergency of international concern, and simultaneously India reported the first cases of novel coronaviruses on 13th January. And finally, on March 11, WHO declared this coronavirus outbreak as a pandemic, and as of March 2020, around 255,000 confirmed cases of coronavirus has been reported globally, with about 160,000 being active and ongoing cases, and roughly around 87,000 recoveries across 185 countries, and around 10,400 deaths with the coronavirus disease. This is the current status of COVID-19. When we look at the WHO global surveillance of human infections, they have given the definitions of suspect cases of COVID-19. And what is the definition of suspect cases of COVID-19? It says a patient with acute respiratory illness, anyone like cough, shortness of breath, fever, and with no other etiology relating to clinical manifestations, and a history of travel to the country reporting the local transmission of COVID disease during the 14 days prior to the onset of symptoms. So this is the definition of suspect cases of COVID disease. We also have the second definitions, and it says the patient with any respiratory illness and having been in contact with a confirmed or probable cases of COVID-19 in the last 14 days prior to the onset of symptoms. Similarly, we have the probable case. So who are the probable cases of COVID-19? The suspect cases for whom the testing for COVID-19 is inconclusive. That implies the result being reported by the lab is inconclusive. Then we have the confirmed cases of COVID-19. A person with a laboratory confirmations of COVID-19 infection irrespective of the clinical sign and symptoms. So these are the standard definitions given by World Health Organizations for the suspect case, the probable case, and the confirmed cases for global surveillance of COVID-19. Now coming to the lab diagnosis of COVID-19, what does CDC recommend to diagnose coronavirus infections? So according to Center of Disease Control, CDC recommends nasopharyngeal or oropharyngeal swab or sputum for the diagnosis of coronavirus infections. But the investigation of choice for diagnosing coronavirus infections is real-time polymerase chain reaction.